Hello, my name is Dr. Eli Whitney with the Heart and Vascular Institute of Texas. Cardiovascular diseases, such as heart attacks and strokes, cause half of all the deaths in America each year, and in patients with diabetes, cardiovascular diseases cause at least 70% of all deaths. For these reasons, preventing cardiovascular diseases is important for virtually everyone in our country. We clearly know that controlling high blood pressure, stopping all use of tobacco, lowering blood cholesterol, eating a proper diet, performing regular physical exercise, and treating diabetes will substantially reduce the risk of developing cardiovascular diseases. In the next few minutes, I want to talk about the HOPE study, which has shown us a new way to significantly prevent cardiovascular diseases. For the past 20 years, physicians have been using ACE inhibitors in the practice of medicine. ACE inhibitors block the formation of two chemicals in the blood called renin and angiotensin. Both renin and angiotensin do bad things to the arteries that feed our body. In the past, we only used ACE inhibitors to treat high blood pressure, bad kidneys, and congestive heart failure. Several years ago, medical scientists suspected that ACE inhibitors, by blocking the formation of the bad chemicals called renin and angiotensin, would prevent cardiovascular disease in people without high blood pressure and the like. In the Heart Outcomes and Prevention Study, or HOPE study, medical scientists took over 9,000 men and women who had a history of cardiovascular disease or who had diabetes and one other risk factor for cardiovascular disease, such as high blood cholesterol, smoking, and the like. They split them into two equal groups. One group received the ACE inhibitor ramipril, also known as Altace, while the other group received a placebo, or a pill that looked like a medication but was made with cornstarch. None of the patients had uncontrolled high blood pressure, weak heart muscles, or bad kidneys. All patients were started on 2.5 milligrams of Altace a day for 1 week. The dose of Altace was then increased to 5 milligrams per day for 1 week, and finally to 10 milligrams per day. To get into the study, the patients had to have normal blood pressures. The average blood pressure fell from 139 over 79 to 136 over 76 with Altace therapy. Despite the small reduction in blood pressure, within 1 year, the risk of having a heart attack or stroke decreased in the group receiving Altace compared with the group who received the placebo or the inactive pill. By 5 years, there was a 26% reduction in risk of all cardiovascular deaths, a 20% reduction in risk of dying from a heart attack, a 32% reduction in the risk of developing a stroke, a 37% reduction in the risk of developing sudden cardiac death, a 23% reduction in the risk of developing a weak heart muscle, also known as congestive heart failure, and a 24% reduction in the risk of developing bad kidneys. In the patients with diabetes, the improvement was even greater. There was a 37% reduction in the risk of all cardiovascular deaths, a 24% reduction in the risk of all deaths, a 22% reduction in the risk of developing bad kidneys, a 22% reduction in the risk of needing laser therapy for bad eyes, and a 33% reduction in the risk of stroke. Furthermore, the risk of developing diabetes in the patients who did not have diabetes at the start of the study was reduced by 34%. In the HOPE study, the reduction in risk of developing heart attacks and strokes with Altace occurred in both men and women, in patients with and without diabetes, in patients with and without a history of high blood pressure, and in patients with and without previous cardiovascular diseases. In essence, everyone in the study benefited with Altace therapy. What about side effects? By the end of the study, 28.9% of the patients who took Altace stopped the medicine due to side effects, while 27.3% of the patients who received the placebo stopped the placebo due to side effects. Hence, they're virtually identical. The most common reason for stopping Altace was cough, which affected about 1 person in 20. When the medical researchers looked at non-cardiovascular deaths, there was absolutely no difference between the two groups. At the end of the study, there were 482 total deaths in the group who received Altace, compared with 569 deaths in the group that did not receive the Altace. What does this study mean? This study shows that we can significantly prevent cardiovascular diseases and improve survival by using ACE inhibitors in people who have known cardiovascular disease or who are at high risk for developing cardiovascular disease due to the presence of diabetes. The reduction in risk does not come from a reduction in high blood pressure. The question often arises, are all ACE inhibitors the same? That is Altace the only ACE inhibitor that is beneficial? The answer is not known for sure. If you have had a heart attack, stroke, blocked arteries feeding your legs, or diabetes, you will benefit from therapy with Altace. The side effects are minimal, with the main one being cough, which occurs in roughly 1 person in 20. 1 week after starting Altace, we routinely perform a blood test for kidney function and potassium level, since Altace, like all ACE inhibitors, can affect the kidney and potassium levels. The risk of a bad effect on the kidney and potassium levels when the heart muscle is not weak and the kidneys are not bad is much less than 1%. I hope this educational program has helped you understand why I may be recommending Altace for you even though your blood pressure is normal and you feel good. I want to keep you from getting sick and increase the length of your life. This is Dr. Eli Whitney from the Heart and Vascular Institute of Texas.